so much. Well, thank you on behalf of HMA Associates, a health marketing firm. HMA actually is Harrison Maldonado and Associates, founded by our president 20 years ago, who is a Hispanic woman who was really concerned about the way that Hispanics were represented through health communications materials and information, and has been very successful in delivering messages, particularly to government agencies, that resonate with who Hispanics, African Americans, and other market segments are culturally. So today we're going to talk about, of course, our influenza campaign under the CDC. And I just want to let all of you know I'm a native Richmonder, so I'm very excited to be on this call today. Next, in terms of the slides, please. Thank you. So today we have an agenda that includes introductions, our goals and strategies, our campaign successes, local coverage data, 2014 through 15 flu season plans, and of course, lessons learned. Next. Next slide, please. Okay, our goals are to promote awareness of the importance of and benefits of the influenza vaccination, to disseminate CDC culturally and linguistically competent communications tools, and we have some great tools that we'll share with you, to maximize partner resources to promote activities, to build partner capacity for sustainability of flu vaccination promotion and ongoing evaluation. Next. Our campaign strategies include creative development, media outreach, partner engagement, social media strategies, and of course a sustainability plan. Next slide, please. And our results are phenomenal. This is reflecting 2011, which was our campaign inception, through 2014 campaign years. We've recruited over 700 multi-sector community partners, coordinated over 450 flu vaccination clinics in 49 cities, engaged over 300 media partners, generated over 188 million donated impressions from radio, print, television, and online outlets. This is significant. This is earned, not paid media, and look at the numbers. And over 430,000 uninsured people were vaccinated against the flu. Next slide, please. Let's take a snapshot of Virginia, the population for Virginia. And again, we're working with 3 different target markets. We have African Americans, Hispanics, and Native Americans. We don't have the Native American portion of the campaign in Virginia, and we'll have Blake tell you later what they're doing toward that end with respect to Native Americans. However, as you know, there are Native American populations in Virginia, so we wanted to reflect those statistics. So with respect to Hispanic, you see the percentage is 7.9%, African American 19.4%, and Native American or Virginia Indians 0.36. Next slide, please. Now let's look at our state influenza coverage rates for Hispanics in light of that statistic. And we're in Virginia, D.C., and Maryland, so we're reflecting statistics for those states. Our total vaccination state coverage was 49.4%. And for Hispanics, we have a statistic of 44.2% for Virginia, and you see the statistics for the other 2 areas. Next slide, please. For African American coverage, total vaccination state coverage is 49.4%. Look at the statistics for Virginia. We have 44.5%, and we have statistics for Maryland and D.C. So those statistics are more evenly divided. We don't have statistics for Virginia, but we have a need in Virginia, so this call is so very important we want to invite you to question Blake on some strategies that might be employed to reach out to the Native American sector. Next slide, please. So we're going to talk with you now about plans for our upcoming flu season, which we're in already, 2014 through 2015, focusing on partner engagement, media outreach, partner recognition, and research. Next slide, please. So respect to partner engagement, for 2014 through 2015, our community outreach will focus on 50 targeted markets. We are engaged in Binational Health Week, which is the largest mobilization effort in the Americas to improve the health and well-being of the underserved Latino population living in the U.S. and Canada. We also have each December activities associated with National Influenza Vaccination Week, which this year is the 7th through the 14th, encouraging people to get vaccinated during that time and into the new year because, as many of you know, many people think that this is the height of the flu season and that they can't get the flu in the spring, which they can. So we motivate and we vaccinate actually up to April. And finally, National Immunization Awareness Month, which occurred in August. It's a CDC initiative to build awareness of the importance of immunizations, and our partners engage in that as well. Next slide, please. Again, during the 2014 through 2015 flu season, with respect to partner engagement, our partners, these are cursory examples. They actually can get broader than that, but it's faith-based organizations, historically black colleges and universities. We're at Virginia Union through the Richmond City Health District, a very active campaign. Assisted living housing and adult daycare centers. You know, senior citizens are a very important market to be vaccinated, and that's why we work very, very strongly with adult daycare and senior citizen living. Grassroots organizations, job centers, homeless shelters, food banks, small businesses, and organizations that work with young and older adults. Next slide, please. Now I'm going to turn this over to my colleague, Alfonso.
Thank you, Patricia. And hello to everyone. Our media outreach, continuing with our efforts for this upcoming season, includes webinar series. NIVDP, which is this partnership, the National Influenza Vaccination Disparities Partnership, it's a CDE initiative, and we have come up with a couple of innovative series of webinar training series, like Flu 101, that covers the basics of influenza. Another one on misconceptions. There are a lot of misconceptions and myths associated with the vaccine and with the virus itself. We also cover media. We train our partners and we give them some information, important information on how to reach media, how to write press releases, how to get in contact and maximize their partnerships in the region. And also we talk about partnerships, how to create stronger and networks that are able to sustain on the long run. We also work on social media. We have a Facebook page that we encourage you to visit and also to like us. It's on Facebook, and we are under NIVDP. So there we provide a lot of information, updated information, surveillance, CDC data, and we have, I'm going to talk about it down the road, but we have important information and updated information there to share with our partners. We also work with bloggers, and we have some Twitter campaigns with some hashtags and some information related to flu. We also work with traditional media, TV, radio, newspapers. So we usually target local newspapers, like which one is the one in Richmond, Patricia?
We work with the Afro, and we've actually had coverage from the Richmond Times-Dispatch as well. Did I say Afro? I don't know if the Afro is still in Richmond. I'm not quite sure. Is it? But anyway, the minority papers in Richmond.
Because they service our target audience. So it's important for us and for when you are reaching out to minorities to speak their language.
Sorry, Richmond Free Press.
Thank you, Patricia.
You're welcome.
And we also include subject matter experts. Those are CDC experts. They are medical doctors, physicians that know about influenza and that have a very accurate information coming from CDC on all flu-related information. We also engage some local physicians, and we even now include our partners, our NIVDP partners, that we've been giving them a couple of training sessions to talk to media to be more fluent and to actually deliver the message the right way to the media. It's important to have a local voice and someone that is well known in the community that relays the message on influenza and the importance of vaccination. Next slide, please.
And I'm going to start with the next slide. We have been extremely successful with respect to getting mayors to deliver proclamations about the importance of the flu. The Richmond mayor issued one. We've had mayors throughout the country to do the same. And this goes a long way with respect to campaign credibility and building the relations across partner networks, not just those that I've mentioned earlier, but with vital community organizations and businesses that can support our partners' goals.
Also, we found that it's very important for our partners to be recognized, and CDC also understands that. And through NIVDP, we recognize our partners with, of course, what Patricia just mentioned, the proclamations. We also recognize them through our influential newsletter, which is a monthly publication. This newsletter is distributed to about 600 people, but it goes viral in a matter of minutes. And we actually reach out to thousands of people, about over 3,000 people. So this is a tool that is very informative, that is simple to read, that it's interesting, and that it goes viral. So it's a cost-effective way to reach a lot of people. We include special editions. We have 3 different special editions, and they are released during the summer. We have the African American edition, the American Indian edition, and the Hispanic edition. They're very successful, and I am sure that Blake is going to share some information when the turn comes in. So there's successful stories, and we also use this as a very informational tool with updated information for our partners. We also do story banks. It's recollection of personal success stories that are shared with partners and organizations on how we can help each other to promote influenza, what are we doing in our community, and how we can help others. Maybe implementing a campaign that is being successful in Virginia can be replicated in, I don't know, maybe in Florida. So there's a good communication tool for our partners and for CDC. We also do recognitions on Facebook. We do a lot of postings. We do flu facts. We share pictures with our partners. People love to be put out there and recognized on pictures, especially if they're doing a nice vaccination event. It's always nice to see people getting vaccinated and what are they doing in their community. We post their activities. We also post all of the free resources available from CDC, and we create conversations. That's what we're all here for, to create conversations and to deliver that important message on flu vaccination. And we also do Twitter. We have some hashtags. We do some Twitter chats, which is actually very informative, and there we also engage our subject matter experts into conversations and into promoting the flu vaccine. And, of course, important information is also posted on Twitter. Next slide, please.
Can I make an announcement, please, before I next slide? Let's put an open mic, and I can't continue to interrupt the speakers. Please make mics muted. Thank you.
Okay. this is upcoming research from CDC, and it's going to be completed by early 2015. This is very specific on Hispanic populations, and it's a fact based on former research that healthcare professionals play an influential role in flu vaccine acceptance and patients' acceptability. So CDC will conduct research on Hispanic physicians and their perceptions on recommending flu vaccination to Hispanic adults. Unfortunately, we know that sometimes our patients, not only Hispanics, but African Americans and American Indians, don't get this recommendation directly from their physicians. So this is something that CDC wants to pay more attention and learn more about it and educate our physicians, which are probably our first motivator and our first point of contact with the influenza vaccination. So CDC is going to select 4 target sites to sample the diversity based on Hispanic population. And we'll do research, including analysis of beliefs and attitudes of Hispanic physicians. So hopefully with this important information, we can gain a lot of insight, create new, culturally accurate information and products, and this eventually will become or benefit other populations as well. Next slide, please. Our new products, NIVDP will create, right now we have a fact sheet. We have a couple of fact sheets based on our population, and those fact sheets include products, resources, and all the free materials from CDC. So the new thing that we're going to do is that we're going to turn them into interactive flu fact sheet. So we're going to save a lot of trees by going digital on this, and this is what the population and it's going to be a cost-effective way to reach out to our population. We're also going to do a mobile game. A lot of our population are mobile, and we are all connected to our cell phones, so it's an educational mobile game. And we're going to update our content in the Circle of Life radio PSA. Circle of Life is our campaign targeting American Indian, Alaska Native populations. So I'm sure Blake also is going to expand on this. And another new product will be our community resource kit. It's a very important tool. I'm going to talk about it later on. And the Yo Me Vacuno social media product. Yo Me Vacuno is a campaign targeting Hispanics. Flu Talk is the name of our campaign targeting African Americans.
And Circle of Life.
And yeah.
Circle of Life is Native American.
Next slide, please. As I mentioned, the Community Resource Kit is one of our new tools. It's a one-stop shop for all flu-related information, and I encourage you to go and visit this and download if you want, and you can even print it directly from our website. The link is down there, and this tool includes basic facts on influenza, health disparities, national influenza vaccination tips, engagement strategies, media outreach, and success stories. It's a very visual, easy-to-read product and also easy to share, so I encourage you to go to it, read it, visit it, and if you have any questions, you can always contact us. Next slide, please.
And I will expound on the next slide. This is the culmination of all that we have discussed. And first of all, one message does not fit all. And that's an important fact to remember, because very often with campaigns, the assumption is that people are monolithic, but people are very diverse.
That's the Circle of Life. I've got a couple of their posters from last year.
Their background,
It's
even
really
within
cool.
cultural groups. So it's important to know that you have to do the research that shapes the definition of who people are and deliver the message accordingly. Relationships matter. We would not have this partner network were it not for the relationships that have flourished, partners telling others about the campaign, and by telling others, they join. Relationships matter. People do things for people. Cultural values are critical. The way of life of the distinct populations is very important, and it goes along with the other two facts that we've just mentioned. So understanding the cultural values and delivering the message with respect for those values is an important element in the campaign. No replacement for good science. You know, there are many myths about the flu. The flu vaccine gives me the flu. Don't I need it just once in my lifetime, such as thinking it's like another kind of vaccination, which is one vaccination as opposed to yearly. So having the medical experts really does help to frame a message that is built on the science. And our fact sheets reflect that. All of our materials reflect that, such that people are informed. And witnessing success is a powerful tool. We have seen so much success in this campaign in the short time that it's been here, and success breeds success. And through the portals of communications, be it those we create or those that people read about or see in media, it becomes contagious. So we want to thank you very much for listening to our portion of the presentation. Next slide, please. And we invite you to hear what Blake is doing, which is so exciting. Thank you.
I know there's room for Q&A later on after Blake's presentation, so if you have any questions, we'll be more than happy to answer those after his presentation. Thank you so much, and good luck. Blake, please go ahead.
Thank you. Before Blake comes in, please, let me make an announcement that we keep getting feedback from a microphone that is open, and it appears to be it's Arlington Health District. Could you please mute your mic by making sure the red button in the center of the microphone is lit red as opposed to green, please? And if any other health district with a green light on, please make sure that is red. Thank you. Would like to move over to our next presenter, but before we do that, I would like to thank Patricia and Alfonso for their splendid presentation. And please, their contact information is available on the screen. You can copy it for a few seconds, and then you can reach them with further questions immediately after the second presenter. We'll have time for questions and answer, about 5 minutes. I'll move over to the next presentation. Blake, you have it.
Thank you very much. Hello, everyone. Thank you for joining me this morning and inviting us to come and present. HMA and myself, Kaufman. My name is Blake Harper. Give you a little background on me. Before joining Kaufman and Associates, which is a Native woman-owned business here in D.C. as well as Spokane, Washington, I had been working with the National Indian Health Board, which serves all federally recognized tribes throughout the country in providing health services and working with health programming at the national level with federal agencies. And so I've been doing health communications marketing for quite a few years now and working with American Indian tribes. And I'm honored to be here to present to you and share some of the strategies that Kaufman and Associates uses. As I mentioned before, Kaufman and Associates is a Native-owned, woman-owned business by Joanne Kaufman, started back in the 90s, and she basically is filling the same void that Irma from HMA is doing with the Latino population. She recognized that American Indian communities are desperate. They're many times isolated and don't interact with state, local, or federal agencies in the capacity to give them support services for health, for housing, any other social service type programs that are afforded to many other people throughout the country are not afforded to American Indians, Alaska Native communities. Go ahead and move forward. Slide, please. So our Protect the Circle of Life campaign, as Alfonso and Patricia mentioned, is really just an offshoot and incorporated into the larger CDC initiative, which is the National Influenza Vaccination Disparities Partnership. I kind of wanted to start off this presentation with giving a little bit of background on Virginia Indians. As you probably well know through our history books, even though history is fairly limited as far as the information you can receive about the origins of American Indians, especially along the eastern coast, a lot of people, don't realize that there are large groups of state-recognized tribes, of federally recognized tribes within the entire eastern seaboard. Many of the tribes were obviously during relocation efforts by the U.S. government relocated west to Oklahoma and other reservations, or joined other tribes and banded with other tribes within their clan systems and moved westward because of colonization happening. To give you the brief background, Native peoples have lived obviously in Virginia for over 10,000 years. There's very well documented societies, clan systems, tribal systems within this state. There's several indigenous languages within those tribal systems. And obviously, Jamestown marked the first successful English colony in 1607. There was about an estimated 20,000 American Indian population, which today, if you consider that number back in 1607, or if you consider that number today, it might seem small, but back in 1607, it's actually a very large number for a state. And by only 100 years later, there were a few hundred individuals that remained from that number. Obviously, a lot of those, I think, had either moved or, as I'll explain later, had assimilated into the culture. Next slide, please. So as I just mentioned, throughout the 18th, 19th, and 20th centuries, there was a really forced assimilation and acculturation between American Indians and English colonization happening within Virginia. So you had many tribal groups, tribal clan systems that basically were acting in their best interest by joining the society that basically had enveloped them. There were documented cases before relocation efforts happened in the 18th century and 19th century that American Indian tribes on the eastern coast were very well assimilated into the culture, had doctors, nurses, entrepreneurs, had really become what you think of as, normal society. This is not a situation where, the American Indian groups within these cultures in Virginia and other states along the eastern seaboard were just being, rushed out and forced westward. Many of them stayed and assimilated to the culture. And one instance of the state of Virginia actually, quote unquote, erasing American Indians from the registries happened in 1924 with the racial integrity law. Dr. Walter Plecker was actually a public health advocate and worked at the Bureau of Vital Statistics. He basically divided the racial integration only into white and colored ethnicities, and that basically did away with a lot of the registers we had of the Virginia Indian tribes. Now, obviously, a lot of those cultures, societies have survived through the years because families band together. They band together in many ways, and in Virginia, in instances, they band together through churches, mission schools. Many of the Indian tribes had schools that went up to about 7th grade or so. And there were a couple instances I found where there were colleges that were allowing American Indians to join their colleges for professional, education beyond the 7th grade, but it was very limited. It was also obviously somewhat in line with this concept that there's really just white and colored individuals, and so American Indians, in many cases, were banded together with African Americans in the state of Virginia. Next slide, please. So today, what do we see today? Today, based on the U.S. Census from 2011, I got some numbers and did some number crunching. There's around 41,000 registered American Indians living in Virginia today. There's 11 state-recognized tribes. As you'll see the list in front of you, those are the state-recognized tribes. You can find resources online that give you a better description of each of the tribes, each of their tribal histories, locations that they live. and where their tribal homeland is at this point. I think around 4 or 5 of them have actually gone through the process with the Bureau of Indian Affairs to try and apply for federal recognition. So those are still in process. However, I just wanted to let you know that at this point, you potentially would have federally recognized tribes located within the state of Virginia. And as you'll see in the next slide, if you can go into the next slide, there are major differences between federally recognized tribes and state recognized tribes. These are some of the most notable ones. Obviously, the most notable difference between a federally recognized tribe and a state recognized tribe is a federally recognized tribe is a sovereign nation. They maintain a legal and political relationship directly with the federal government, and it's a government-to-government relationship. The state-recognized tribes are acknowledged by the respective states. So within your state, Virginia has recognized 11 of those tribes to be, ethnically and politically diverse and unique, and they are recognized by your state as a nation. Another difference between federal and state-recognized tribes is that federal recognized tribes have certain federal benefits, services and protections, are eligible for funding and services from EIA, which I've already mentioned, along with other departments and federal agencies throughout the U.S. government. In state-recognized tribes, there are some entitlements and service and funding negotiations between the state, whether that's a state compact or contract, depending on whatever service or program that's afforded to the recognized tribes in Virginia. So we'll have to look into some of those aspects of how Virginia recognizes the autonomy of that tribe. With a lot of the federally recognized tribes today, there's a history. There's many of them were able to very early on in colonization and Manifest Destiny, were able to work with the U.S. government, write up treaties that are still recognized today. Those treaties, in many cases, will state the land that they are afforded, will state their rights, and in many ways, the acts of Congress, the presidential executive orders, and other administrative actions and federal court decisions back up that federal relationship. At the state level, there are, legislative and executive recognition processes, but they're less robust than the federal level. And so it might even be more difficult. And I think this is how this plays in. It's very difficult for state-recognized tribes to enter into discussions with local and county and state organizations and departments within the state government to try and access better services for their people and their communities. And it really just, throughout the United States, even with federally recognized tribes, it's still difficult for that process for tribes to interact with government agencies and have their buy-in and their support to help out their community in any way possible. And so it really just lends the opportunity for the state or the federal level or the county and local level to show good faith in wanting to work with American Indian communities by coming to them, by making themselves available in the right ways to help those communities and connect with those communities. And I'll discuss some of those things that you can do in some future slides. Next slide, please. So this is the iconic image that we've developed for the Protect the Circle of Life campaign. I'll begin to talk about the importance of imagery, the importance of making sure that you connect with the community and hear from them about the needs that they see are most relevant. Also, you want to make sure that your campaign materials and your messaging materials are going to resonate with them. The image you see in front of you is something that we worked with in a focus group with around 30 to 40 different tribal nations throughout the country. We got their feedback on what would resonate most with them, and the idea of protecting the circle of life. The circle of life is obviously, a concept, an indigenous concept that goes from birth to death, and that you are connected in each of these phases as you'll see in front of you in the center of that, each of those is a phase, childhood, adolescence, adulthood, and elderly. And so you're connected through each of those, and it is a circle that continues. And also the concept of, this flu vaccine, specifically talking about influenza, is something that protects me, but it also protects you. Trying to get to that level that is easy to understand, but also resonates the clear message in the campaign, which is it's in getting an influenza vaccine, although you might think it's not worth it, you might have elderly around you, you might have babies around you, you might have people that are immunocompromised that need you to have that vaccine. And so that concept of community comes into play in our campaign messaging, and I think it comes forward in our main theme that is throughout our communication materials and our messaging materials. Next slide, please. So just a little bit about American Indians, and specifically on flu. I took this data from an Indian Health Service report in 2003, and American Indians die from pneumonia and influenza at a 1.5 times higher rate than the general population. Flu is also the 6th leading cause of death among American Indians and Alaska natives, which is far less for elderly, those over 65 among the general population. Also, flu can cause certain health conditions to become worse, including diabetes, asthma, heart and lung disease, and other chronic conditions. American Indians still have vast disparities between the general population when it comes to those certain health conditions. So you're looking at a vulnerable population here, and it's a population that needs to be reached. And if there's any instance in which you can do that, I would encourage you to take that opportunity, because we would like to, hopefully in the end game, do away with health disparities and make sure that all people are given the same opportunities when it comes to these great life-saving tools and techniques that we have in modern medicine today. Next slide, please. Part of our main campaign is actually reaching out to these American Indian and Alaska Native communities that are throughout the country in the lower 48 as well as Alaska, and trying to increase their yearly influenza vaccine numbers. A lot of that is done through personal relationships that Kaufman and Associate has with Indian Health Service clinics, with tribally run clinics, with urban Indian facilities. And one big point that I want to make is that urban areas within the last 25 years have grown exponentially in their American Indian Alaska Native populations, even in the last 50 years. And part of that is due to the fact that there were many campaigns back in the 1950s, 60s, and 70s that were driving American Indians from their reservations to the cities in hopes of jobs, in hopes of education. And so there's large urban areas throughout the United States that have increased American Indian populations due to that. And so we've also made it a point that we're focusing on some of those urban centers, so that not only the reservations and the rural isolated areas, but also urban Indians within those urban centers are hopefully being treated, getting services, getting programs, because many times, even within an urban center, you still have health disparities between general population and American Indians and Alaska Natives. And so that's really disconcerting too. You have people and communities that are actually located in centers that have great services and great programs, and yet there's still high disparities. So making sure that even within urban centers, you still have communication, messaging, promotion, health promotion materials that speak to that community, resonate with that community, and hopefully help to decrease those health disparities. Next slide, please. So these are just some photos from flu vaccine events that we've had. That top image is from the flu vaccination event for the National Influenza Vaccination Week last year in 2013. It occurred in New York City. New York City has a very large American Indian population, and there's a American Indian community house there that focuses on health promotion, gives some health services to the community, and they held an event that was actually during a blizzard. So it had a lower turnout than expected, but they were able to give out vaccinations to the community at that event. The bottom two photos are from another event that also happened in December 2013 during an IPW in Arizona, or I'm sorry, Albuquerque, New Mexico. It was a drive-through flu clinic. They had over 500 people come and drive through and get vaccinations. It was a very successful event. We had partnerships with universities in the area, with the Center for Native American Health at the University of New Mexico, the tribal connections for the tribes that are in that local area. There's many tribes located in New Mexico. And so it's really, it speaks to how you want to develop, a possible flu clinic with some of these American Indian communities in Virginia, that you want to try to work with as many different organizations as possible so that they can carry the message to the people and they can help to make sure that your flu event is a success. One thing that we've noticed in all of our campaigns is that we can provide the materials, we can give them all the information that they need to hopefully make it a success and change people's minds as far as how they think about the flu vaccination. But it's really up to the family members, the doctors in those communities, other elders, even tribal leaders, to really impress upon the community members that this is a serious thing to think about and thing to consider and hopefully support. And so it's really about getting those community members to pass along that message, because that's really, really important for American Indian communities and Alaska Native communities. Next slide, please. So these are just some more pictures of the posters, brochures, as well as some fact sheets that we've developed. We will be adding some of these materials to the community resource kit that Alfonso mentioned. Also, we'll be developing other materials that will help hopefully communities write newsletter articles, potential PSAs. Some of the things that we're doing this next year for our new products are actually developing new PSAs that have native greetings ahead of the English PSA, so that it hopefully we've done research and we know that many people that might not even speak fluently in their native language know native introductions and greetings, and they hear that and they immediately listen into a message, and they find that really resonates with a lot of people. So we're developing native bumpers that will be in, I think, 3 different specific native languages: Navajo, Yupik and Yupiat for Alaska, as well as Lakota, which is Sioux language in the Plains, the Dakotas. And so those messages will be available on CDC's website, and hopefully in the future it could potentially spawn other native languages to want to use the script that we've developed and put their own native greeting at the front of it and air that in local media, so the message about the protected circle of life can go even further in local and regional markets. Next slide, please. This is a social media widget that we have created, and it's been sent out through Native media outlets. We have the National Indian Health Board that has it posted on their website, as well as some other key health organizations throughout the country. We've worked with colleges. There's a Indian College Fund that has sent out this widget and has it posted on their website, and it basically goes through 6 different questions about flu to test their knowledge. Hopefully, by going through this little quiz, hopefully it actually decreases the amount of misinformation that is out there about the flu vaccination, about the flu. And so that was our hope with the social media widget. We're continuing to promote that this year. We would love to have it promoted in Indian organizations or Indian tribes in your area, so feel free to contact me if you'd like to, if this is something you're interested in trying to promote. Next slide, please. As I mentioned earlier, we have the radio PSAs. There are 4 already online. We're adding to those. with the native breedings that are coming ahead of it, and those will hopefully be available in the coming months before, the huge surge in the vaccinations for December in IBW. Next slide, please. The influential newsletter, as Alfonso mentioned before, this has been very popular among the American Indian organizations that we've worked with. I've noted here that we had actually 2,800 views in the May 2014 American Indian Special Edition of Influential News. There's actually a 500% increase from 2013, so we have focused a lot of our attention on making sure that our contact information is up to date. That's one big thing within American Indian communities, and probably other communities as well, is that there's a lot of turnover potentially. So keeping partnerships going can be difficult at times, but you just have to keep some sort of connection and some sort of effort in making sure that your contact information is up to date and that you're working with the best information possible. Because as you can see in these numbers, there's definitely a vibrant American Indian community online and that is wanting more information about success stories throughout the nation that's happening for influenza, as well as other things that Kaufman and Associate works on in the health realm, as well as education and other fields. But specifically for health, there is a very vibrant community within tribal clinics, Indian health service clinics, and urban facilities that are wanting to get more connected and hopefully share their stories more on the national forefront. So feel free to contact Alfonso. He can connect you to the Influential News newsletter, and if you would like to send those on to the American Indian communities in your area, I'm sure that they would enjoy the stories, as well as hopefully want to connect with how they can be a part of the partnership. Next slide, please. Just to reiterate partner success, we've had numerous partners in IBW that have done some amazing things. This is an adorable picture on the right here of a Alaskan sled dog who's wearing a little sweater that says "Immunize Alaska's Kids." The Alaska health system is very unique in that it's different from the rest of the U.S. The Alaska Native health system that's run by the Alaska Native corporations actually provides healthcare to all of Alaska's population. They have great success in their health promotion campaigns. They're having a big event coming up in October for the Alaska Federation of Natives, where they expect to vaccinate hopefully thousands of people as they've done in years past. And so we'll be hoping to make sure that our materials are there to pass out to further drive home the message of protecting a circle of life and how important it is to get a flu vaccination. And then also this left picture is a picture from the Native Health Organization in Phoenix, who received a Big Shot Award, which was given out actually by Arizona State. So recognizing American Indian communities for the work that they're doing is something that the state can do to help develop those relationships as well. Next slide, please. And I think this is one of my last slides. It's just about impacting outcomes, improving lives. By supporting the Protect the Circle of Life campaign, our partners are really helping to positively impact outcomes at the national and community level. They gain recognition for their commitment to promoting public health in Indian country and really are helping to save lives. The picture on the right is from a flu vaccination event in South Dakota, Rapid City, I believe. And it just is another example of how the community in any way possible is working to promote the flu vaccination in their communities, and we want to fully recognize that on the national level. And so we're working with HMA and CDC to make sure that we have increased participation between our partners on the CDC's website at their partner portal, where they can post their stories of success, where we can assist them in developing articles that they can post in local media as well as the national level on, as Alfonso already mentioned, NIVDP's Facebook page, CDC's Twitter. There's lots of different avenues that we're hoping to interact with partners to bring them into a partnership to hopefully sustain this partnership through those social media avenues as well as other aspects of CDC's campaign. But that's pretty much all I have. Next slide. Just want to thank you again for allowing me to come and present to you today. I appreciate your time and be happy to answer any questions that you might have.
Thank you very much.
Alfonso and Patricia, if you guys are available as well.
Thank you very much. We will change the program a little bit to go straightly, in the interest of time, to go straightly to the panel of our best practice presentation from both Chesterfield and Richmond City. And our presenters, thank you so much for presenting. It's my understanding that you'll be on the call, so immediately as time is available after the panel discussion, we will have time for question if available. So thank you. We will now move to our panelists, starting up with Chesterfield.
Thank you. This is Janine Uzel. I'm the nurse manager in Chesterfield. Just wanted to share some things with you that we've done to help make our immunization clinics more client-friendly. And if you could go to the next slide, please. As you can see from these numbers, we've had a large influx of non-English speaking residents to our county. We have the largest Hispanic population in the region, and in our clinics we're also seeing a number of other languages such as Arabic for our kids that are coming in for back-to-school immunizations. Next slide, please. To care, lack of interpreters and translators, lack of current printed material to give both the screening tools and our VIS statements. We've also identified that our clients have difficulty with transportation, getting rides to the health department. We're not on a bus line or any type of public transportation. We need convenient clinic hours for working parents. A lot of the individuals that we serve do not have paid time off, so time off from work is difficult, and a lack of health insurance. Next slide, please. With our interpreters, we have managed to increase our number of bilingual staff and are very thankful that our staff are so willing to act as interpreters. But this season we had a little bit of a staff shortage, and we reached out to our MRC, and our MRC volunteers were able to provide 2 individuals that helped us tremendously with our back-to-school immunizations. We do use the language line as well, although we find that that does slow down the process somewhat. And also, Chesterfield County government has a database of interpreters that we can use, and these individuals will also help us to translate immunization records if they can. And of course, most of you know immunize.org has the VIS statements in different languages. Unfortunately, they're not always up to date as we would like them to be. Next slide, please. All of our immunization appointments, with the exception of the evening clinic appointments, are walk-in appointments. So parents can bring their kids in 4 days a week. We have afternoon hours, we have morning hours, we have hours in the evening. And we also have the capacity during the back-to-school rush to increase the numbers of our vaccinators, sort of provide a blitz, if you will, to provide immunizations up to that Friday before Labor Day when school starts and that Tuesday morning. One of the things that we do see with this open access is that when it rains, we tend to have more clients, as again, a lot of our clients that we serve do outdoor type of work that is related to weather, so allowing open access allows them to come in when they can get a ride. and when they have time off from work. Next slide, please. In addition to our back-to-school immunizations, which keep us busy, we have a success story, our women's health team that Cindy Holler leads and Jessica Rubio have developed an outreach partnership with migrant workers here in the county. We provide Tdap and influenza vaccines as well as other health education. And this has worked really well to have us viewed as a trusted resource within this very vulnerable community. Next slide, please. We found that decreasing barriers to immunization can also open doors for us to provide other services. When we do immunizations, we talk about WIC, family planning, maternity. We can help individuals find resources in the school program or connect them to WIC. So we use it to open doors, and again, acting as that trusted resource within the community is very important to us. With me today, I do have Kathy Flippen, our IAP coordinator, Cindy Holler, our women's health supervisor, Jessica Rubio, our outreach worker, and Donna Connor, who is the head of preventive and community health, if time allows for questions. Thank you.
Thank you very much. We'll move over to Richmond City for
Hello, everyone. My name is Kayla Buchanan, and I am representing Richmond City Health Department. And in Richmond City, we have been very successful in vaccinating our minority populations against the flu. According to the U.S. Census, 50% of our population is Black, and we have a 6% Hispanic population. So we try to target these two populations. And we found that barriers to them getting their influenza vaccine or access to care, such as Chesterfield was talking about, transportation, not being able to come to the health department during the proper hours. There's also lack of insurance and misinformation about the flu vaccine. Most people have various myths concerning the vaccine, such as because they're healthy, they don't have to get the vaccine, or the flu shot makes them sick. So in order to overcome these barriers, we try to meet our population where they are. We partner with local organizations that are trusted within the community, such as churches, shelters, nursing homes, community centers, and colleges. And we also partner with Walgreens, who offers free vaccines for their clients. So what we do is try to set up a flu clinic at one of our partnering organizations, such as a church, and we take a Walgreens pharmacist with us, and they can provide the vaccine on site. And we usually take people from the health department to be there to provide education and to help dispel myths. And we also provide bilingual staff as needed. Last year, between September and November, we vaccinated approximately 300 people, and 70% of those vaccines went to minority populations. Another way that we were able to vaccinate people was by partnering with our EP&R department, and they have an annual event every year that is used to determine how fast they're able to vaccinate large numbers of people. So we use this event as an opportunity to vaccinate our minority populations, and last year we were able to vaccinate over 500 people in less than 4 hours. So this event proves as a very effective way for us to get people vaccinated at one time. Last year, we also started a flu pilot in schools. So we partnered with RPS, Richmond Public School System, and we worked with our health department staff to go in during the school day and get these children vaccinated. And it took a lot of work getting consent forms, but once we did all of that, the process was pretty seamless. And we also work with HMA Associates, who provides us with their flyers and their targeted materials for our various minority populations. And last year, during the National Flu Week, we got a lot of media attention from radios, newspapers, and local news channels. And we also had our mayor sign the National Flu Week proclamation. So basically, through partnership, we're able to reach out to the minority populations and get them vaccinated.
To make sure they can hear us.
Oh,
Thank you. Are you hearing me? Did you hear Kayla? Everybody? Okay, thank you. We will now have few minutes. I think it should be about 15 minutes for question and answers. Our first two presenters, in fact, three presenters are still on the line, so you could ask them questions. If your questions are not answered, if you don't have the time to ask a lot of your questions or all of your questions, you can also email them to me. My email is augustine.doe@vdh.virginia.gov. And then we will make sure we funnel them to the right people to respond to you and provide that to you also. So I will turn it now over to our panel moderator, Ms. Abigail Johnson, who will now control this session.
Hello, everyone. If anyone has a question for either our three first presenters or Chesterfield or Richmond, please go ahead and unmute your line. Any questions? I guess I can start us off with a question for Patricia and Alfonso.
Sure.
You mentioned that framing messages was really important toward dispelling myths and encouraging people to come out and get vaccinated. Can you talk about the processes or strategies that you've used to frame messages for specific populations?
Sure, thank you. Well, we mentioned our materials, and we also mentioned that we focus group test our materials. We don't make assumptions just because I'm African American and Alfonso is Hispanic. We look at the cultural context. We talk with the partners because the partners are at the community level and they are trusted. And we rely on what they say about what we're creating, coupled with putting together focus groups such that we can test the messaging with people who represent the target populations before we put them into the public domain. You want to add anything?
Yeah, it's also important for them to see themselves reflected in the ad or in the printed material. So if we are going to develop a campaign or a poster, let's use the example of a poster. If we want to create a poster targeting Hispanic people, we don't want to put someone that doesn't look like them. It's important for each population to see reflected in the ad. Use the same language they use, colors that are representative. Don't be stereotyping, but make sure that you know who you're talking to and what they want to hear. So before we launched this campaign, we did some research and some testing in some focus groups, as Patricia mentioned. So before we created all this product, or those free products that are available on the CDC flu website, research was done, and it's like a never-ending research project. So every time we have to ask our target audience, we need to know their capabilities. You talked about location and someone talked about the new languages or dialects in Virginia. We need to know what they're talking, who they are, identify them, and how to help them. Someone also mentioned lack of transportation. That's important. So that means that we have to actually go there, knock on their doors, and not expect them to come to us.
And that's the beauty of this campaign, that Walgreens goes to community. They go to where people live, where they worship, and so you eliminate the transportation barriers that exist quite often. Is that an answer to the question?
Yes, thank you very much. Are there any other questions from any of the participants from the health departments?
Hey, Augustine, this is Alfonso again. I'm sorry. Will this presentation be available? It's being recorded, right?
Yes. Yes, sir.
Thank you.
Yes, this presentation is being recorded, and it should be available as a resource to VDH employees. We will work with our IT to make sure that we have it as a resource on our website.
Great, thank you.
Once you have that, can you share the link with us, Augustine, please?
Absolutely.
Thank you.
This is Loudon. If we didn't register for the train course yet, can we still do that?
Unfortunately, it should be expiring. I cannot guarantee that I can open it, but I will see. Let me talk to Brad Bradley and see what can be done. Send me your name and information so I can talk to him if there is a way to have you registered later on. But I think it should be done after time expired.
Augustine, may I ask a question?
Yes, ma'am.
Thank you. For those listening, are any of you working with Virginia Indian populations? To your knowledge?
We have a response here for you.
Okay.
Teresa Teague. I do a little bit of work with one of the tribes.
I'm sorry, which health district are you?
I'm with the state office.
Oh, okay, the state office. Because Blake, are you still on?
I am.
And perhaps she and you could have a discussion, just a suggestion.
Sure, feel free to email me if you have any questions about connecting with the communities in your area.
Thank you.
Augustine, what is your last name for your email address, please?
Thank you very much. My last name is Doe, D-O-E, Delta, October, Echo.
Thank you.
Any other questions? I have a question for either Chesterfield or Richmond. We talked about many different barriers to vaccination uptake, such as transportation, language, trust, economics. In this period of limited resources, how do you choose, or do you choose to focus which particular barrier you would focus to address within your respective communities?
Well, this is Chesterfield, just to chime in. We address what we can and look for creative ways. Our staff are very flexible. Like I said, we've increased our number of vaccinators. We've reached out to MRC to provide services for us, and those have been good resources. We are always looking for ways to meet the needs, and our open access policy, as far as no appointments, seems to be helping to meet that need in the community.
And this is Kayla from Richmond City, and I think that one strategy that RCH does well is look outward towards our partners and see which ways they can help us to eliminate barriers, such as Walgreens, who plays a very big part in being flexible enough to go to community sites so that we're eliminating transportation barrier, and they also provide the vaccine for free, which eliminates the lack of insurance. So by looking outward toward partners, we're able to see what they can offer us, and that way we can see which barriers we can tackle.
Thank you. Any other questions? Last questions?
Well, ladies and gentlemen, in closing, I would like to say thanks for being there. First and foremost, let me thank our presenters, Ms. Green, Mr. Pernia, and Mr. Blake. Thank you so much for taking off time to present to the state of Virginia on a very important topic, especially that can't come anytime better than when we are now into our flu season. So thank you so much.
Thank you for having us.
I would also like to thank the panelists, our Chesterfield team, and also Richmond City for being there. And most importantly, and especially, let me also thank Dr. Daniel Avula for ensuring that both the presenters were here and also the panelists were here available to present to us. I thank again the Office of Minority Health for keeping out this very, very resourceful training program. And like I indicated earlier, there's a window now from now to the 30th of September for you to submit topics of interest for consideration into our 2015 training series for the year. Please submit them to me. My number is you can submit them to me via email. I will really encourage email. It's augustine.doe@vdh.virginia.gov. Please. And also, please make sure that you sign in the sign-in sheets so that I can approve your attendance in Train Virginia, and then you will get credit for attending this session. Also, last but not the least, we will have this training posted, and when we have that done, we'll send out the information to our partners that presented and also our participants so that you can share with people who didn't have the time to be on the presentation today. Also, last but not the least, I just been reminded that you should please fill out the evaluations that were sent to you. Please fill them out and send them back to me. They're very crucial to ensuring that we serve you better. We use the feedback you write on the evaluations to enhance our program and be a better service to you. Thank you very much. And please watch out for our 2015 calendar.
All right. Training's off.